Good morning and welcome to the Collardale and Huddersfield NHS Foundation Trust induction process. Hello, my name is Owen Williams and I'm the Chief Executive of the Trust. Today I'd just like to talk you through some things that really set out the context of what we're here to do. Just to say, if you've got any questions or queries, please feel free to speak to your line manager, or if you've got some things that spring to mind, obviously ask. The most important thing for you to take from this brief introduction from myself is about compassionate care. That's what we're about. And when we talk about compassionate care in CHFT, fundamentally what we're talking about is what we describe as the 4 pillars. The first pillar is about putting the patient first. Sometimes easier said than done, but what we're really trying to do is make sure that in anything that we do, patients are at the heart and the centre of our care and the way that we think. The second one is about go see, and what that's really about is to try and say we want to learn from other people. Now, other people could be the ward next door, it could be out in the community, or it could be us sharing some really good practice that others learn from. So that's what we mean by go see. The third pillar that we talk about, and it's really important, is that we work together to get results. It's not always easy to achieve this, and what we mean by this is when we're trying to do change, that as far as possible, it's not people like myself who are just doing it on my own. It's really about trying to get everybody together to make sure that as far as possible we work together to get results, we do change together, and that the majority get asked, particularly when it's a change that affects them. And the final pillar is that we do the must-dos. We work within a hospital environment, or we're working in people's homes or within a community setting. It's really important that those policies and procedures that we know we have to follow to protect our patients and also to protect ourselves, that as far as possible we do the must-dos. So as I say, compassionate care underpinned by those 4 pillars that I've just described is really what we're about. So welcome to CHFT and all the best for the future.